Good afternoon, everyone, and welcome to our 2020 Texas Benefits Forum Series. TBGH has been hosting this annual event for about 8 years, usually in two locations, Houston and San Antonio, and sometimes in Austin as well. But there's a first time for everything, and bringing this program to you virtually is a first for us. The good news is that employers all over the great state of Texas can participate without having to travel anywhere farther than their computers. And 131 business people are doing that today. So welcome, and we're so pleased to have you all join us. This year's Benefits Forum features 4 virtual sessions and 4 days spread over 2 weeks. Today, tomorrow, next Wednesday, and Thursday. We just wanted to avoid virtual meeting fatigue for you all by spreading it out like this. And they all start at noon as today's and end at 1:15. You should have received an email with a separate login for each session. You're in for today's session, but you also have to separate login for each of the 3 remaining sessions. Let us know if you'd like to resend that email. The meeting will be recorded today, and we'll be able to send it to all of our participants afterwards. We're very grateful to our sponsors who are making it possible for us to offer this valuable educational program to Texas employers and members of our 3 Texas Business Group on Health coalitions: Dallas-Fort Worth Business Group on Health, Houston Business Coalition on Health, and San Antonio Business Coalition on Health. In appreciation, we've offered each sponsor an opportunity to showcase their company and their services for 3 minutes in one of the 4 sessions. And today the spotlight is on AbbVie and on Pfizer, both longtime supporters of the Texas Business Group on Health and our programs. So let me introduce our AbbVie account manager, Suzanne Goot. She has worked with us for many years and has been a wonderful supporter for us. Good morning or afternoon, Suzanne. Hello.
Hi, Marianne. Good to see you.
Great to see you too. We appreciate your support. So, Suzanne, AbbVie is a major pharma company that develops new medicines for several critical disease areas. Can you tell us a little bit? We have a slide here showing some of the disease areas, but perhaps you can elaborate on the focus and also how you help employers help their employees overcome certain diseases or improve their health.
Sure, Marianne, and thanks for the opportunity to talk with everyone today. I'll certainly miss seeing everyone live as I have at prior years' TBGH meetings. But in general, I would say that 2020 has been a particularly exciting year for AbbVie. As many of you may know, AbbVie was sort of the biopharmaceutical spinoff from Abbott, and that occurred about 7 years ago. And we were really focused on primarily the development and marketing of specialty products. So drugs used to treat things like immunology disorders, autoimmune diseases, disease states like HCV, and recently women's health conditions like endometriosis and uterine fibroids. And so predominantly our work with TBGH and employers and employer coalitions over the last several years has been around specialty pharmacy management and disease states under the specialty umbrella. But what's been unique about this year is that in the second quarter of the year, we completed the acquisition of Allergan. And so we're presently integrating a wide variety of disease state areas, and you can see those represented on the slide. And with the acquisition, we now have more than 47,000 employees and a much wider range of medications for disease states in more than 60 areas. So we continue to be an innovator manufacturer with, a goal overarching of developing products for unmet needs. But, I would say that, our journey this year as an employer team, and we're a relatively small group that works directly with employers and employer stakeholders, is to figure out where there are some unmet need in these areas where we've integrated the Allergan business, and namely in areas not limited to, but in areas like migraine, bipolar depression, gastroenterology diseases. And so we will certainly be interested in feedback from employers on where there may be some care gaps or unmet needs in these particular areas.
Mm-hmm. Well, I have to say, Suzanne, that all of the areas you have listed on this slide are very, very important to employers and their employees. And the resources that you're able to bring and offer us for complimentary always is just really invaluable. We make some of these available at our different meetings, and in different programs as well as sometimes on our website. And it's always good to have a person like you be such a good friend of our coalition and the work that we're doing. We really, really appreciate it, Suzanne. So thank you, and thank Abby for this. I appreciate it.
Thanks, Marianne.
The next sponsor that I want to thank personally is Ardena Lane. She is our account manager for Pfizer, and Pfizer, as like Abby, has been a very long time supporter of our organization. So Ardena isn't joining us visually or virtually today, but she has sent us a short video that's she'd like us to show how not just Pfizer, but all pharmaceutical companies are helping support.
At a time when things are most uncertain, we turn to the most certain thing there is: science. Science can overcome diseases, create cures, and yes, beat pandemics. It has before. It will again. Because when it's faced with a new opponent, it doesn't back down. It revs up, asking questions till it finds what it's looking for. That's the power of science. So we're taking our science and unleashing it. Our research, experts, and resources, all in an effort to advance potential therapies and vaccines. Other companies and academic institutions are doing the same. The entire global scientific community is working together to beat this thing, and we're using science to help make it happen. Because when science wins, we all win.
And our thanks to Pfizer and all the other pharmacy companies that are working so hard to right now.
At a time when things are most uncertain.
So hopefully that we'll have a big breakthrough and get the vaccine and the right testing and everything else in order to conquer this pandemic. So thank you. Let's jump right into the session one, and let me introduce our speakers briefly. I won't go into all the details, but we're so pleased. The topic that we're offering today, talking about today, is 2021 benefit strategies for the new normal. And this is front and center on all benefits managers' minds right now. I'm pleased to introduce Marybeth Gray with Treon Group at Marsh McLennan Agency. She is the Senior Vice President of Health and Welfare Consulting with Treon and supervises the overall account management for her clients. And she has worked hard and has great success in continually reducing costs for employers and their employees, because she absolutely understands the insurance market and the whole healthcare system. And that's what she'll be talking about today. Before we start with Marybeth, I'd like to introduce Sue Prochaska, Director of Benefits for Rice University. Sue is a longtime member of the Houston Business Coalition on Health and working with the Texas Business Group on Health. She provides a well-suited, thoughtful benefits program to the university's very diverse employee population, and she's very passionate about her work. She directs all aspects of the university's benefits programs, strategy, administration, design, delivery of health and welfare and retirement programs. And not only is she an expert senior professional human resources certification, she is also a member of the State Bar of Texas, holding a JD degree from South Texas College of Law. And to top it off, she's triple busy working as the chair of the board of directors of the Houston Business Coalition on Health. Welcome, Sue. We appreciate you joining us today. And I'm also pleased to introduce Jonathan Markard. He is the health and welfare benefits consultant at BP America. I think everyone knows about BP, and based in Houston. I hope you batten down the hatches for what's coming your way, Jonathan. But Jonathan is responsible for various health and welfare benefit programs, including the pharmacy plan and the on-site health clinics for BP employees and their families. He has been a regular speaker for the Texas Business Group on Health and is a strong member and loyal member of the Houston Business Coalition on Health. And so I'm so pleased to have you come back and be with us today, Jonathan. Thank you. So we'll start with, we've got a couple of questions that we wanted to queue up for this discussion when Marybeth starts. There are two that will be in the chat box. One is, please consider this as she's speaking and as Sue and Jonathan are speaking. Have you finished your 2021 plan design yet? And what are the biggest changes you've made? And the second question to consider while we're going through the session is, what are the biggest challenges for you for 2021 with COVID? And what's the best advice you can give others in your industry that has employees that have continued to work on site throughout or have returned to work, having been working from home? So with that, let's start with Marybeth. Has a video that she's going to show, and I think you'll learn a lot from her.
Good afternoon, everybody. Welcome to the Texas Business Group on Health 2020 virtual conference. I'm Marybeth Gray, and I'm going to be kicking off our first session today. Joining me will be a group of employers, and they're going to talk about their strategies and their thought process on what's at the forefront of their minds in developing their 2021 benefit strategies. So today we have an exciting session for you. We're going to kick it off first with a state of the market overview. We're going to go through some of the technological changes that are occurring in our world, some of the new to market thoughts and strategies deploying digitalization of healthcare, and things that employers might consider for their benefits package. Cost is definitely at the top of mind, and we know that most employers are leaving no stone unturned in trying to find cost savings opportunities. So we're going to discuss strategies that are being thought about as leading opportunities. We're also going to spend a little bit of time discussing re-enrollment in a virtual world. So sit back and enjoy, and thank you so much for joining us today. All right, I'm excited to talk a little bit about the state of the market to kick our session off. I am a healthcare consultant. I've been in the business for over 25 years. I work for Marsh, a division of Marsh, Tryon Consulting. We're sister companies with Mercer, Guy Carpenter, Oliver Wyman. We're the biggest consulting firm in the world. And our job is to stay out in front and keep you in the know and be the thought leaders. So we are in a obviously precarious situation with COVID-19. The new normal has presented HR as employers across the country with unprecedented challenges. We are in a work from home mode, which means we have to change the way that we normally do business, and the business of benefits has to continue. So what we're going to talk about today is technology, and how we can use that to allay fears from our employees and their families. We've kind of all entered this pandemic and we're still very anxious. And I think, especially in public places, we have to understand that mindfulness and mental health have to be considered in what we're looking at for 2021 in our healthcare benefits. I loved this quote from Dr. Lindsay Jarnigan, and I wanted to share it with you. You'll get a copy of these slides. So instead of seeing social distancing and travel bans as panic, try seeing them as acts of mass cooperation. We all need to be very careful. We need to be thoughtful when we're in public. We need to protect the most vulnerable in our society. And it's not about us, it's about a collective planet and a collective group of Americans helping each other. And I want to also say that within our HR community, we're all here to support one another. And it's venues like this where we come together in a virtual conference to share ideas that really help us collectively build what we're going to have to do for 2021 and some of the challenges we're facing in communicating to our remote workforce, running open enrollment differently, maybe using apps and different means of communication than we have in the past. So conferences like this where we're sharing ideas and sharing different strategies of how we're approaching things is always beneficial to everybody. So again, we're going to talk about technology. When I talk about the technological advances in medicine, I really am talking about how employers can save money, right? So in this very difficult time, employers are leaving no rock unturned when it comes to where can we save money. Benefits are second to payroll in most cases, and we are looking for an opportunity to save money while improving the quality of care that we're offering our members and employees. And then we're going to go right into the employer panel to get everybody's ideas on what strategies and solutions they're developing and or are considering for 2021. It's been a challenging year so far. The first half of 2020 has been, it's rocked our world. So we need to be focused on navigating our path to recovery. And that's what we're going to focus on today. A lot of exciting new things happening in healthcare, tons of new technology that we're going to talk about today that employers can actually embrace and use in value-based plan designs. So one of the things that I've seen change over the last 12 months, specifically towards the end of last year and definitely the beginning of this year, is employers are sick to death of understanding their utilization but not being able to do anything about it. So when we sit in utilization meetings and we find that there's 179 people with diabetes in our plan, and 5 people are enrolled in disease management, I think employers have had enough. That's nonsense to have 5 people enrolled. And why is it that we only have 5 people enrolled? So be thinking about that when we talk about the technology, because you could develop value-based plan designs around some of the technology that's out in the marketplace today. And a value-based plan design is really a thoughtful approach to getting consensus with your employees and getting on the same page with your employees and their families. So it's saying, if you do this, we'll give you that. So if you look at the top 3 disease utilization categories that employers consistently have in their utilization, number 1 is heart and congestive vascular issues, stroke. The second one is cancer, and the third one is leading cause of utilization is diabetes. So if you just take diabetes, for example, you could put some of this technology that we're going to talk about today into place and say, if you participate in our disease management programs and our thoughtful programs on helping you manage your state of diabetes, right, we will waive half of your copay for your prescriptions, or, if you will do this for us, we'll do that for you. And it really is a win-win, because they're going to be healthier and cost you less money and be more productive at work. So value-based plan designs have definitely been at the forefront of the planning for 2021, especially in the light of what we're going to talk about in a minute. So our devices, we need to really embrace the new world we live in, and doing things, especially open enrollment and communicating open enrollment the same way that we have in the past is really antiquated. And we really need to be thinking about how we can embrace the change in our environment. And I think things in the next 5 years will change more than they have in the last 50. The pace of change, specifically in healthcare, is Star Trek or George Jetson. And I know I'm dating myself a little bit with that example, but things that we used to think of as sci-fi are here. So let's talk about the marketplace for a minute and the challenges this is imparted to employers. We've had, since the end of 2017, tons of integration. And what's the theme with CVS buying Aetna, Cigna buying Express Scripts, Amazon buying PillPack? You can see Optum is owned by United Healthcare. You can see that the marketplace disruption that has taken place, the theme behind that is consolidation for the marketplace. And the medical carriers are teaming back up with the pharmacy benefit managers. So self-insured employers have the option to carve pharmacy out. They always have, right? So carving out means you have one carrier for medical and a different carrier that's managing your pharmacy. We've seen a ton of advantages for self-insured employers carving out. They get better pricing, they get better contractual language, they get better clinical management programs and trend management, and they have a dedicated unit for specialty drugs that not only process the specialty drugs at a greater discount typically, but they also reach out to the members and help them with these very expensive drugs. I'm a big fan of split first fills, which we do on all of our carve-out clients, where on a specialty drug, the member will get a half a script and they'll pay a half a copay, and the employer pays half of the monthly copay. And some of these drugs are thousands of dollars a month, to allow the person to see if they have side effects and if they can get through the self-administering of an injectable. There's a lot of hurdles with some of these specialty drugs. So not being able to carve out, which is something that we're seeing with this consolidation, is viewed by me as something that's restrictive to self-insured employers. So some of these, if not all of these carriers, are saying now if you're under 1,000 employees, you can't carve out, which again is the consolidation has definitely not been beneficial to smaller companies that, you know, want to be able to take advantage of better pricing. The other thing that's happening in the marketplace is we've watched Walgreens buy Village MD, which is a primary care physician doctor's office opportunity for them, a major industry disruptor. Walmart has done the same thing, CVS with their health hubs that are opening across the country that started out in Texas. Really what they're doing is trying to develop a patient-centric focus. And they're trying to, in my opinion, kind of garner the market share and the ecosystem of healthcare. Really the front end is what they're trying to control. So it's very difficult to, with the physician shortage, the primary care physician shortage that's facing us in most metropolitan areas, for the millennials to get care the way that they want to get care. Millennials are the largest population in our workforce. It's the largest generation in our workforce, and they really don't want to wait 2 months to go to a primary care well visit. So these health hubs and these new venues of getting primary care are very appealing to millennials. Like I said, the marketplace has really pushed a lot of these out. Amazon has taken advantage with PillPack, right? They know people don't want to go to the pharmacy, wait in line, get their prescription medications, or come back to pick up their scripts. PillPack is packaging your full, all of your medications by when you need to take them and delivering them to your house. So, and they have now a pharmacy license in all states. So it really is interesting how this is changing what we imagine as our future. And really, we need to be thinking about these things and integrating these thoughts into the planning for our benefits programs. And again, by 2025, we're going to see care very radically changed from where it is now. And it's really going to be changing from treating diseases to prevention of disease. The Mayo Clinic is even launching an at-home hospital model where they're sending the technological devices home with the person. Specifically, what they used as an example in this particular article was the NIC unit, so the neonatal intensive care unit, sending babies home with their families, which is in a better, safer setting, especially during this pandemic. With the tools for them to monitor the baby while the baby's at home instead of in the hospital, a much less expensive setting for an employer as well. So something to come. Artificial intelligence is here, folks. It is here and it's real, and we can use this stuff. So we're going to talk now about facial recognition, biosensors, all the technology that has been enhanced become a lot less expensive, and we can embrace that in some of the value-based plan designs that we're using. Precision medicine is something that is here. It's very exciting. So precision medicine, you know, most employers, at least most of my clients, are allowing coverage of the genomic testing. So if somebody were to go to their family physician, it's completely private. They do the mouth swab, and they can actually tell you what you have a predisposition for genetically. It also, so the example that I can use is colorectal cancer, where the average person has a 2% chance. If you have the biomarkers in your genetics, you almost increase to 60 to 70% chance of getting colorectal cancer. Same with breast cancer and the BRCA gene. So there's all kinds of new technology that, again, is morphing us more from treating illnesses to preventing them. Because certainly if you're out in front and getting your preventive checks, cancer is a lot more curable and treatable if it's caught early. The other opportunity that you have with this is diagnosing already availed issues. So there are artificial intelligence eye exams that can indicate heart disease and diabetes well in advance to how we used to do eye exams. So a lot of critical changes in things that you need to keep up with in your plan design. So we all read about Google and Project Nightingale. Why are these big tech companies after our healthcare data? The tech companies are investing heavily in healthcare. Amazon, Apple, IBM, Microsoft, they're outpacing the pharma companies almost by 3 times. So it's very significant how these tech companies have really gone after the healthcare industry as the next way to integrate their technology in our lives for better health. So we're going to watch a video now that's going to talk a little bit about the competition in the healthcare space, tech versus pharma.
By the year 2030, the global healthcare budget is estimated to rise to $15 trillion. Not surprisingly, a tug-of-war for this massive market is already underway. Tech giants like Amazon, Microsoft, Apple, and Alphabet see a huge opportunity to digitize the healthcare space. They're vying with pharma titans like Pfizer, Merck, and GSK, companies with only modest experience in managing zettabytes of digital information. Whoever is best able to utilize every individual's digital health record fed by his or her data ohm will capture significant new profit pools and disrupt existing ones. Apple has already made a foray into digital devices like the massively popular Apple Watch, which now can accommodate ECG capabilities and detect atrial fibrillation. As Apple CEO Tim Cook recently stated, Apple's greatest contribution to mankind will, ultimately, be about health. Microsoft has moved into biopharma tech by investing in wet labs, and in collaboration with DNA Nexus, has launched a set of cloud-based tools for genomic research. In 2019, Google acquired Fitbit for $2.1 billion, positioning itself for monetizing the last inch, and has invested in more than 30 biotech ventures in diverse therapeutic areas. As for Amazon, it disrupted the pharma supply chain by purchasing PillPack for $753 million, and has invested in Haven, a joint venture formed to tackle rising healthcare costs. Perhaps Stuart Varney put it best: the tech giants are extending their tentacles because they have the money to do so. And clearly, they do. The top 6 tech companies have $509 billion in cash, while the top 20 biopharma companies have only $199 billion in cash. It might not be long before we're seeing Dr. Apple for our next physical.
So that was a great video, right? And it really does show you how the top healthcare technologies are embracing genetic wellness, biosensors, really the next decade being very transitional and transformative in healthcare in the morphing of treatment of disease to prevention of disease. Apple has come up with, their Apple Healthcare division has come up with many, many apps designed to promote healthier habits, nutrition, meditation, fitness. If you look at some of the health category apps that you can download, mindfulness is one. I listen to that Zen music before I go to sleep. You can find almost anything in your health apps. And if you think about diabetics, so we use the diabetes example, but now there's a patch. So no longer do diabetics need to prick their fingers and test their glucose. It's a patch that monitors their glucose and sends an alert to their smart device, their phone, and it can even send a note to potentially their doctor if the person consents to that. So it's really incredible the things that technology has given us. If you have an asthmatic, especially a child, who ends up in the ER often, which some childhood asthmatics do. Smart devices can delineate where you are, your location from your smart locator, and tell you exactly what the pollen count is, the air quality, the humidity, the temperature, so that asthmatics can take their inhalers with them if they're going someplace on a day where the air quality might not be good. Do you remember the days where our watch used to just tell us the time? Well, now they're an EKG. So if you had somebody that was struggling with congestive heart failure or a high claimant where some of this technology would come in handy, right, to monitor their heart rate on their watch. One of my next door neighbors loves to bike. He's very athletic. And his watch told him that his heart rate stayed elevated too long. It happened 3 times on long bike rides. So he went to his cardiologist and he had triple bypass surgery. So his Apple Watch saved his life, potentially. So very interesting way to monitor things. You can monitor high blood pressure. This toilet seat was developed, I kind of giggle because who can be serious about a toilet, but RIT, Rochester Institute of Technology, developed a toilet that will monitor your blood oxygenation level, your blood pressure, and the FDA has cleared it as a device for transmitting patient information to hospital and providers on congestive heart failure. It's coming down in price. I think it's like $3,000 right now, but they're coming down in price. So again, if somebody's suffering from congestive heart failure, this would be a great way to monitor their heart rate without them having to do anything. This was super cool, and I put it in here because I found this really interesting. But most diabetics wear glasses or contact lenses, and this contact lens has a microcontroller built into it that actually monitors your glucose 8 hours in advance to the patch or any other technology that's on the market today. Again, you could say if you participate in our disease management program, if you're a diabetic, we'll cover half the cost of these contact lenses. And again, anything that would get out in front of an adverse event would avoid a hospitalization or an ER visit. Obviously, monitoring the glucose. So we're going to spend a few minutes on the pharmacogenomics, the new therapies coming to market, the genomic editing specialty medications that are millions of dollars. I actually did a full seminar on pharmacy and the pharmacogenomics with really interesting videos and explanations on what a genomic treatment is, what it does to the body. They're life-altering, life-changing therapies. Of course, employers are grappling with them because they're multi-millions of dollars, and those stop-loss lightning strikes are going to become more commonplace as more and more of these treatments hit the market. So I have a YouTube video of that 1-hour session if anybody's interested in seeing it. So the $1 million lightning strikes, as I said, we used to see them 1 every 10 years. Now they're a lot more commonplace with some of these new genomic treatments. These genomic treatments are typically administered in the hospital, right? Zolgensma is a hospitalization. So it's the drug plus the hospital stay. And most of these drugs are going to be running through the medical plan, not the pharmacy plan. So one of the challenges for employers is, as these hit the market and more are coming to market, I think there's 50 to 60 in the next 5 years that are in the pipeline under development right now. Employers are trying to figure out, not only how do we pay for them, but how do we keep our plans sustainable with more and more of these therapies. So the marketplace in 2020, the BUCA carriers, some of them have come forth with a plan of attack on these genomic therapies. So right now there's 2 on the market. The third, that was supposed to be FDA approved for hemophilia at the end of this month, was shockingly denied by the FDA and did not receive approval. So that's still going to be yet to be determined when that comes to market. But some of the BUCA carriers, Aetna, Cigna, Anthem, have devised a fully insured product for these gene therapies, meaning for a self-insured employer, they're saying, we're going to carve out these genomic therapies, we're going to manage them, we're going to pay for them, and you pay us a fully insured PEPM, almost like carving them out of your self-insured risk pool. So more to come on that. Some of them are stop-loss solutions, some of them are fully insured products on the medical plans. And we actually are developing a spreadsheet to compare all of them, including the one from Tokyo Marine Stop Loss Program. The gene therapies really replace the faulty gene within the body. So they're really exciting breakthrough therapies because not only do they either stop the progression of the debilitating disease or cure it, but they cure it for future generations for that person. So you're actually going in and fixing the broken lettering in their genomic structure, which is actually going to fix it for the future generations, which is crazy. And again, I have a little video from Time Magazine in the session that I did in early August. There has been a lot of progression in gene therapy. We've talked about it started in probably 2008 with the first one, Zolgensma, then the retinal drug that came shortly thereafter. We were waiting for the one at the end of August that is supposed to treat hemophilia, but that was not FDA approved. But you can see that there's a ton in the pipeline, which is great on one hand because we're solving and curing diseases that have plagued us for hundreds of years. The problem is that they come at an extraordinary cost, and there are more and more in the pipeline, and you can see the cost there with the market impact to the employers. This, of course, didn't get FDA approval as it was supposed to. Curious, that's the first time I've seen that. So we'll be interested to see how that progresses. And of course, 61% of the injectable drugs were concentrated right here in the top 20 drugs, and the top 5 are to treat cancer. Again, most of those injectables are delivered in the doctor's office, so running through your medical plan, not your pharmacy plan. You all need to be pulling that information when you're looking at your pharmacy costs, so the J codes and the Q codes, which are the pharmaceuticals running through your medical plan, taking a look at those and kind of piecing them back together on the high claimants. So we take a step back and look at what's happening, new initiatives implementing for 2021. Of course, virtual care solutions, a more focused strategy on our top claims drivers. We talked about 90% of the dollars being spent by 2 to 5% of our population, really trying to garner our employees and their members to participate in disease management through value-based plan designs, coupled with some of the new technology we shared with you today. I'm a big fan of centers of excellence, especially for things like cancer treatment. We have 11 cancer hospitals in the US that do things differently than potentially local hospitals. So really trying to imagine a better process at helping our members and their families achieve the quality of care that they deserve and that we're paying for. So we're going to move right into the panel discussion today and navigating our path to recovery, where we're going to talk about some of the challenges facing our employer brethren today. And just keep in mind, we're all in this together. So I'm excited to hear what our panelists have to say. Great, so we're going to start off with a question to the panel. And Jonathan, since you popped up first, we're going to give this question to you. Managing benefits during the pandemic, what are the biggest challenges that you faced? And if you can share some tips with our fellow employers on how you've handled those, that would be fantastic.
Yes, absolutely. So it started off initially with we have a business at BP where we can't just stop. We have people who have to go to not the office, but the factory, the refinery, the oil rig in the Gulf of Mexico. They're not there now because of the hurricane, but we were trying to figure out what can we do to enhance our package to help support these folks. So, simple things that we tried to do were, waive any COVID testing out of pocket, just completely free. We waived the copays for our teledoc and our MD Live benefit, so that they could have immediate access as needed. A lot of us were maybe just at home and not really having to go out in the world, but those folks were still having to go out in the world, so we wanted to do that. We also have another huge issue going on in our company besides COVID, which is a reorganization. Right before COVID hit the US, our CEO in London said, we're going to reorganize and we're going to focus on alternative energy and all great things. We're excited for the new company, but we are sort of reshifting our focus, and we need to grab bigger, better talent. And a lot of that talent is going to come from the tech industry, believe it or not. So now I have the conundrum of I've got the COVID, I'm trying to get that under control, and now I need to be able to recruit high tech talent in our organization. So it was, how do I enhance my benefit offerings, not only for COVID, but to recruit? I needed more money. Was basically what it was. And what I started to be able to do, and this is even for just COVID, and the response was, I started to shift benefits to kind of open up more opportunity to expand in certain areas. Like, in a very simple example was, we offer the Bright Horizons backup child care and elder care benefit. I noticed that our backup child care was zero when nobody was requesting child care. Everybody was at home, right? So I said, hey, look, we've pre-purchased X amount of these things for the year. We're not even going to come close to it. Can I kind of reshuffle, take some of those away? And then I said, hey, I want to support my employees with their children going back for the school year. And so tutoring help and just getting, children into the online learning kind of environment and helping with that. So Bright Horizons has a really great program, by the way, if you want to look into it, that addresses those issues. So I was able to pay for that to enhance the benefit offering by simply shuffling around some things in my current benefit. One other, I think the thing we had to do is we had to start renegotiating. For example, with the pharmacy plan, we did a market check. We were planning on doing it actually, but it was very timely. Had to try to find ways to save money. If I can come back to my bosses with $1 million plus savings, any of that's going to help. And then I think one of the other challenges is we have a very in-depth well-being program. It's 10 years old actually, and it's been the most successful thing is to keep our costs down. When there's so much going on, so to speak, and with some of the things that Marybeth was talking about in the video, and we have to ask them to do things for us, do things for them, and I think we're going to just transparent. You'll have to get your minimum point. We'll still give you an HSA contribution if appeals may come in the end game. Couldn't get to my doctor, they weren't open, maybe, and that's fine. I think very lenient in those manners, and I had to relate mental well-being back to drive engagement. I want suffering from any issues with all that's going on, COVID and within our company, sneaking in properly. So I've been really pushing on.
Great. Okay. Jonathan, it seems like you're frozen, so we're having a
Open
few
back up.
technical difficulties. Why don't we turn to Susan and see if she can share some of her thoughts on, of course, managing benefits through the pandemic, some of the biggest challenges that they faced at Rice University, and how she's handled that. Susan?
All right, and my picture will not show up because I lost my internet while we were watching the things earlier. So I am here, but through my cell phone. So I would say probably the one of the ones that popped up to me the quickest was looking at my benefit claims and seeing them tank. I mean, the claims amounts every week came in were just just had dropped 20-30%, and trying to figure out how much of our lower utilization that was happening at the beginning of the pandemic and even through today, how much of it is things that are going to be pent up need versus utilization that may never take place. So things that are people not getting people not getting preventive care that they need, that they should be getting, and what's going to be the effect of that down the line, and how can we mitigate each one of those things or support the employees through each one of those things in order to make it go so smoothly, because some things like births, those haven't changed, those keep coming through, but we're really concerned that people continue to get their prenatal visits, because that's really important to make sure that the birth goes well. So we're doing communication on that, and then there's some things that should be attended to and people are not wanting to go to the hospital for, they're afraid, and that's the heart attacks and the strokes and the things that are really urgent that they should continue to go to the hospital about. We're trying to get the word out on that as well. Don't stay at home if you can't breathe and you've got an elephant on your chest, those kinds of things. And some things seem like they can be put off, but are really not recommended, like the childhood immunizations. So again, getting out the word when we see that number drop. And some things we're not too worried about, like unnecessary musculoskeletal surgeries and those kinds of things that aren't happening. We've gotten an interesting line of communication in through our STD, a short-term disability intake of things that were scheduled and got canceled, and are they being rescheduled? We're watching that pretty closely to see what that outcome is. I think the other thing in this whole area, and we have really tried to encourage people to use telemedicine. We don't have a provider like Teladoc, but the word getting out about telemedicine with the virus has been really amazing, and we have had a tremendous uptick in the use of telemedicine, which is good for several things. I mean, if you're talking to your doctor and you can call them and say, I've got an elephant on my chest, they're going to tell you go to the emergency room, rather than just not having been advised. I also am thrilled, and Jonathan mentioned the importance of mental health treatment throughout this. Our mental health utilization's gone up 35% since we've had more utilization of it in telemedicine. So I am thrilled about that. That is just really excellent. And people are asking us to continue the service, which we really want to find the best way to do that. So we're going to be exploring that. I think people really like having telemedicine with their own doctor. That's what I'm finding. So I think we need to look for a way to make that easier to do. I think it doesn't fall directly into health and welfare, but it definitely falls within benefits. In helping the overall employer manage the COVID. And that is how to keep sick people from coming to work and infecting others when their biggest concern is their paycheck. At first we just kept paying people. If there wasn't work that they could do at home, we just continued paying them. Well, that's really expensive, and most people can't manage that. And with students coming back to campus, we needed a lot of those folks to make it back. So then we pulled it back and we said, only if we ask you to quarantine are we going to continue to pay you. And then we pulled it back a little bit more and said, we're only going to continue to pay you if you got exposed at work or you possibly got exposed at work. And so, most of the people who were being exposed in large gatherings that they did outside of their work. So that exposure was minimal for us. But we were still finding a reticence of people to stay at home. So we gave, in addition to a liberal PTO bank, which we have all the time, we gave them, and we have employer paid short-term disability, we gave them some extra sick days that they can use for anything. No questions asked, 5 days, so that they can use that for their illness, they can use it for their elimination period on the short-term disability, or they can quarantine, whatever else that may come up. And I think getting people back to campus in a safe and controlled manner has been the most important thing we've done, because they're not as afraid. They see that masks are required for everyone, and they see that we are testing a tremendous amount of testing. We're doing all the things that we can possibly do, and that has also reduced that anxiety around coming back to campus. And as Jonathan said, I've also had that people asking me for money. Where can we cut money in the benefits? And unfortunately, that happened really, really quickly, and my wellness was what had to go. So we actually terminated our wellness contract. And so my team is trying to keep up the things that have to happen every year, which are flu shots, and those kinds of things, which we're planning right now, which are more important than ever now that we're in COVID, because we don't want to mix those diagnosis up. So we're going to continue to have also some wellness and good things that are happening from our Gibbs Wellness Center. But it's not easy. And also keeping the financial counseling going. We are fortunate enough to have our retirement plan, have them provide a lot of those services, but reminding people about them, and that it's not hopeless if you lost a few paychecks. Do we just need to get you back on track? That kind of thing. And we have had to look at both our retirement plans and our medical plan to try to find savings. I have to say, I think employers should consider, it seems a little cynical to do, but consider the COVID time as an opportunity to maybe get through some plan design changes that you've needed, but nobody has had they haven't wanted to take the pushback. But now, if you look at, okay, we can lay people off, or we can have these plan design changes, they look at it very differently. And it looks as though I'm going to be able to push through some plan design changes I've been recommending for 4 years and haven't been able to do, that are going to be good for the plan, and I think ultimately for the people. And then don't forget your life and disability. That's another place that you are paying for things. And we worked with our disability carrier to analyze what are some things that we could cut and save a little bit of money that people won't really notice. And they don't notice because until they're on claim, they don't even know we have these things in the plan. One is a COLA. We removed our COLA. That was a nice savings. We removed retirement plan contributions for those who are on LTD, and capping the level of LTD coverage for our highest paid employers. Those 3 things, that doesn't have to be a big deal, but can save a tremendous amount of money. So really thinking as far outside the box as we possibly can.
Those are all fantastic tips, Susan. Thank you so much for all of that. I can't say enough. I am so in agreement with employers having almost an opportunity to make some hard changes that they hadn't wanted to in the past. So we're in the midst of the strategic renewals for most of our 1/1 renewals with our clients, and things like step therapy that may put a little bit more hassle into the plan by getting the most expensive medication. Having employees have to go through the step of using the least expensive and then working their way up to the most expensive can yield hundreds of thousands of dollars. And like you said, it is an opportunity, because I think people understand, most Americans understand that business is struggling right now, and we're looking for cost savings opportunities. So the second question that I have for you, and Jonathan, we'll start with you. Returning to work with new safety precautions in place, many of us haven't had the challenge yet. And if you haven't, since most of your folks are still working from home, what is it that you're thinking about implementing when we do kind of go back into a staggered return to work or a return to work mode in January or February 2021? So if you've given that any thought and have any action plans in place, or you're thinking about things, if you could share that with us. You're on mute.
All right. Yes, absolutely. So I actually served on our return to work team for the U.S., which has been disbanded at this point, but we've done the work. So we kept putting dates down. We kept putting, June 1st, May 1st, July, whatever. And those kept going by. And we just said, forget putting a date out there. We're just making everybody nervous. So what we've done, I mean, when we started talking about returning to the office, initially it felt like this just seems really quick. What are we doing here? But it was important because we started off with a list, 30 pages of what if this, what if that, and it was just exhausting. But we were able to skim it down a little bit. We were able to, we have what we consider 3 phases. So not a big bang, but a 3-phase approach where we have people back at the office right now, all across the U.S. that absolutely, without a doubt, need to be there to do that. And it could be like our cybersecurity team, making sure we're not getting hacked and things of that nature. To our office, our traders on the trading floors, things like that, where their technology is needed and it's not necessarily at their house. That's very minimal. That is a small percentage of our population. We actually we in our phase when we started bringing back folks in 2 of our laboratories, one's in San Diego, one's in New Jersey. We had to close them both down because of infections, and not from the office, but just like it was mentioned, it's coming from outside and then bringing it to the office. So what were we doing? We're providing masks every day, 1 person in an elevator at a time type of deal. So it's really, we realized that this just isn't going to work with the majority of the population. So let's keep everybody out as long as we can. We were going to initially offer, if you want to, you have to express your interest to come back to the office. You will be either recruited. We've even cut that out and said it's just not worth it right now. So in order to combat some of the complaints folks were having, we offered a $300 stipend to get some office furniture for ergonomic reasons, things like that. But what I learned was don't force it, because when we started to, the team I was on, we started to kind of float the ideas that we had out there, people were just absolutely scared. They said, no, we're not ready. I'm not going back. You can't force me to go back up, things like that. And they got kind of feisty about it. I think providing support. So we've promised we would give a 2-week notice when we say you're going to go back to the office. I think that's going to actually go away again, something like that. Not that we won't give 2 weeks notice, is that I don't think a lot of us are going to go back to the office. They're continuing to kind of pulse check us on what our thoughts are working from home. And we're in this reorganization where we're going to see 25% of our world population go down. They're going to look at every avenue. And I think the rent that we pay for some of our buildings is going to be a very big, important reason we don't go back, because we're going to try to sell those things. Be around people. I can't even converse with 3 people. It's not effective. It's going to be less, productive than we are at home. So that's kind of our stance where we're at. We're going to reevaluate as we move forward, but we tried to get a huge team together. We were ready to go, and then it just all fell apart because it just won't go away. So that's where we're standing right now.
I'm looking, that was great, Jonathan. And I think there's a lot of employers that are in the same boat. I'm looking through the chat box. Marianne had posed those questions, and I see a lot of employers saying the same thing, that they've really put a strategy in place where they're planning for coming back. They're not quite there yet. Some are staggered back. mask temperature checks, things like that, are in the chat box as certainly as strategies in coming back to the office. Susan, did you have anything that you wanted to add on your strategy on, I know all.
Can you hear me?
Have maybe, yeah, I'm sorry, my computer went on.
Okay.
But I know colleges and universities were really right now coming back, right? They were either deciding to do remote learning or be back in session. So I know that was a particular challenge to colleges and universities with young people really feeling invincible and maybe not taking the same precautions. So when you have employees coming back, professors and your work staff, what are some of the things that you thought about in your back to work strategy?
I think it's a little different than maybe than Jonathan's. You know, well, certainly the same things were that we had a 3-step process, and the first step was, you know, the people who have to keep things going. The police department had to be there, and the people who keep the experiments going, and those kinds of things. So they were there the whole way through. And then we brought back a few more people, like graduate students who needed to work on those experiments. So a little bit by little bit, so that we could really see and think about all of the environmental and operational controls. I think we have been a little more strict about, you know, some things that are laid out by the CDC as best practice are not negotiable. Wearing a mask is not negotiable. You know, cleaning your area every day is not negotiable. Maintaining your space is not negotiable. But where we could give people and departments some autonomy over what they did was we made each department responsible for their return to work plan, while maintaining a baseline of what was required. So, you know, they were, do you need plexiglass barriers at your desks? Do you see enough people for that? Or is it better if you have a face shield? Or is a mask sufficient for the kind of work you do? Process and control, staffing controls. What's the minimal staff you need? How many people do you really need there? And what can you manage from home? Or doing staggering shifts. They've done that really, really well in the food service area. Now they're serving, you know, 6,000 students a day again. And how do you maintain, if there is an outbreak, how do you maintain it so it doesn't take out an entire, you know, workforce for 14 days of quarantine when people need to eat every day? So doing those kinds of things. And then also just maintaining as much work from home as we can. In fact, we're implementing a new ERP system, Oracle Cloud, completely virtually, which nobody thought we could do, but it's really, it's gone well. I think making safety devices and cleaning stuff is really important, making it easily available. And if you can, do asymptomatic testing. We purchased 60,000 tests that we'll be people will be taking over the course of the semester. And again, it's because our asset we have to protect. We don't have to protect oil wells or any of those things. Ours is people, students, children who have been entrusted to our care. So that's kind of, and I think the last thing is communicate. You cannot over communicate. Rumors in a vacuum, rumors take off, and you really need to get the official word out from leadership about what the situation is.
Fabulous. Well, kudos to you both in doing such a great job managing the challenges that are facing all employers. We had a lot of information in the chat box, and Marianne, I don't know if you can make that available to the participants of the conference, the virtual conference afterwards, but a lot of good stuff in there. Looks like a lot of employers are really taking seriously how to keep their employees and staff safe on our journey back into the office. We obviously, our thoughts go out to those Texans who are facing, and Louisiana, that are facing the impending hurricane that's coming. So everybody, please be safe. and take care. And I'll throw it back to Marianne for any closing remarks.
Yes, thank you very much, all three of you. I actually have a question for you that I think might be on the minds of a lot of employers. Last May, National Business Group on Health did a survey, employer survey, on what their expectations were for 2021 as far as the increase in costs or healthcare premiums. They said 5%. I'm wondering if that's still the case, and what what you three, Marybeth, Jonathan, and Sue, think about that. But my thinking is that, given the fact that your healthcare budgets are just having to be cut dramatically from what you were talking about today, and of course the publication of the health plan's great profits because of the medical loss ratio increase that they've had, which does not apply to commercially insured, by the way. I'm wondering if you're seeing a 5% increase as well, or maybe less.
Yeah, so I'll take that to start with. We're in the midst of renewals. So on the fully insured cases, we're asking the carriers for a reduction, not just a flat renewal, but an actual reduction because of the significant profit margins based on the lack of claims, because people have been kind of delaying care. And on the self-insured side, you can still negotiate your admin fee, right? So admin fees are based on process claims transactions. They've been processing a lot fewer claims. So my thought is they should give some of that back to the employer. I think the unknown for employers across the board, self-insured, fully insured, large and small, is, are we going to see a boomerang effect with care that has had a downturn due to everybody delaying care and delaying accessing care if they can, to seeing a shift back upwards in severity of illness due to them putting things off. We've seen HHS say that pharmacies now can give immunizations. So I think there's a push and a concern that we aren't keeping up with the preventive checks, the colorectal cancer screenings, the mammographies, the things that have that are so important in your health, and maybe seeing things being more severe when we are back to going to the doctors. That's really just, crystal ball stuff. So we don't really know. But I would say going into 2021, I'm expecting our insurance company carrier partners to give back to the employers that are suffering and trying to keep people at work and trying to keep people on benefits. So hopefully we have a strong enough partnership that will come to fruition with the January renewals.
Mm-hmm.
I'll turn it over to Jonathan.
Jonathan, what about you?
Yeah, I agree with Marybeth. I'm a 4-1, so lots to be seen here. We also noticed the drop claims. We had, to your point, absolutely have negotiated our admin fees 100% on top of that one. We kind of were like the drop of the HIF, the health insurer fee. We've been in our actuarial studies have been kind of doing it with or without the HIF, and so we're kind of using that to why we're not having such a big increase. But outside of that, in talking with my main insurer, we'll see some sort of an increase. But what we've done, like I mentioned with our program, is we already incentivize you to go get your your cancer screenings and things of that nature, your vision screenings, your dental cleanings. So we have really pushed the envelope on the communication doing that, especially with clinics at the sites that do have it. We're really continuing to push it. The biggest draw to our well-being program is the amount of points you get for having an annual physical with your primary care physician. And we have continued to push on that. We want people to go to continue that relationship. If something is creeping up, it will be identified.
Mm-hmm. Yeah, thanks. And Sue, what about you? 5% increase, or how are you planning for the obvious increase in the utilization that will be coming from people who've delayed care.
Well, we're a 7-1, so we really just renewed, and we had our pricing set for 7/1/20 before anybody went out for the pandemic. So we have a full year that we can be looking at data before we have to make decisions on pricing. So I think our strategy is to wait and see what we see. Continue to remind people of the things that are important, like getting those preventive care screenings and those kinds of things. But we're going to wait and see. We are hopeful that after a full year and 3 months of all of this, that we'll be able to, we'll have a good idea about what it's going to look like. I could live with 5%. I'd rather be flat or drop a little bit. We were able to, or we weren't, our consultants were able to negotiate an ASO holiday for a couple of months for us with our carrier. So that helps with the cash flow. And so we were very appreciative of that. And we agreed to stay on for an extra year to get that. So.
Interesting. And then I'm looking at the chat box, and there are a couple of other questions that I think we have about 5 minutes to talk about. And this is of all panelists. Well, what success are you seeing with digital solutions? What would you do differently with these services? And I love what you presented, Marybeth, on the digital solutions, the technologies that are really coming online now and being refined daily. Maybe you could address that, what maybe Jonathan and Sue might be able to talk about that.
Yeah, I would say that I have 2 clients that were in the middle of implementation on a diabetic program where if they participate in the disease management program and their adherence rate on their medication, so many diabetics take maintenance medication. And we've pulled utilization for that bucket of employees that suffer from diabetes, type 1 and type 2, looking at their refill rate. So with 90-day supply, are you getting your refill every about 90 days, or is it 165? And if it's 165, you know they're not taking their medicines as they should be every day. So we've put in value-based plan designs where if they're adherent with their meds, and they're participating in the disease management program. And even if your carrier doesn't have one, there's Livongo. There's a new opportunity with precision nutrition coupled with the medicine to help diabetics. It's the contact lenses. So you can kind of really design a plan to say, if you're adherent and you participate in our programs, we'll cover half of the glucose monitoring devices that are on the market today that are FDA approved. Same with the Apple Watch. We have people that are suffering from chronic heart issues and cardiovascular issues, and people on Lipitor or cholesterol management medication, offering them half off an Apple Watch if they participate in the disease management program. So we're going to see more and more of that, I think, because it's a win-win. The employees get something and their families get something to manage their chronic illness and hopefully lower costs, right? That's the goal.
Great. Well, actually, I think we're about out of time. So let me just repeat that the session has been fully recorded, and we will share that with those who have registered. So afterwards, I'm not sure exactly the date, but it will come your way. I want to thank all 3 of you, Marybeth, Jonathan, and Sue, for your very, very insightful and helpful comments and information that you shared. I also want to just remind everyone who has registered today, if you've registered, you are eligible to join us for tomorrow's session, which is at 12 noon again, Central Time. Why managing obesity and related conditions during COVID-19 is more important than ever. And this is because, one of the main reasons is because these are the people who are at risk for COVID-19. So it'll be an interesting discussion tomorrow. I hope you'll tune in. Again, you have received and probably will receive tomorrow morning the new link for this particular session. And finally, I want to mention about September 24th for all of our members. All of our employers are complimentary for our 2020 Texas Cancer Care Symposium, which will be at noon to 1:15, virtual again. It was supposed to have been in person, but it's virtual. Our keynote speaker will be speaking, Dr. Basu, for that overview of the building a comprehensive cancer care management strategy. And then the 3 workshops focused on prevention and early detection, care coordination, and caregiving and sponsorship will be, we'll show those virtually on October 15th. And if you register for one, you'll be registered for both. You should have that information coming to you via email. So thank you all for participating, our speakers, our panelists, and mostly for all of you, our members who tuned in today, or I should say zoomed in today. We really appreciate your engagement, your attention, and hope that you feel like this was worth your time. Thank you again. Have a great afternoon.